Welcome back to Shift Happens podcast. Today we're going to be talking about postpartum care, why the follow-up visit can't be a follow down. Welcome back, my mighty shifters. It's your girl, Corrina Jackson. I am your bougie confidence boss lady, bringing you another real conversation that hits home. It hits hard. I am your morning snack, your noonday nibble, and your evening unwind. So sit back and let's talk about something that is really hard and hits home, but it's necessary because shift happens. And when it does, we talk about it. Now, today we're going to be diving into a quiet crisis hiding in plain sight, the decline in postpartum visit attendance. Let's be real. This might be one of the most overlooked but life-saving visits in a woman's life. And it's the truth. Too many women, especially brown and black women, aren't going back to their prenatal visits. And it's not because they don't want to. Let's just clear that up from the start. It's because of the barriers. The barriers are stacked sky high. So let's talk about it. The numbers don't lie. And shifters, I don't like to lie at all. So I'm going to give you some facts like I normally do on every podcast. According to the CDC, up to 40% of women don't attend their postpartum visits. No, they don't. And that number is even higher amongst Medicaid recipients, women of color, and those in rural communities. And let me just stop and say this. I live in Tulsa, Oklahoma, but around us are a lot of maternal medical deserts. And that means that the appropriate medical facilities are not in those places for individuals of any medical issue really to access. But in this situation, postpartum is after a baby is delivered within that 6 weeks. And a lot of them in these maternal medical deserts don't even have an OBGYN. They only have a nurse practitioner, and sometimes those nurse practitioners are not equipped to deal with a woman that's pregnant. So they have to send them to the next county. And let me just say this. In Tulsa, our own Healthy Start data has shown that even when moms receive great prenatal care, postpartum follow-ups dropped off. And that means that, it's like your pregnancy turns out wonderful, the baby is born, nothing's going on with the baby, you stop bleeding, nothing's going on with your body, no signs or whatever, and you think, I don't need to go to my 6 weeks follow-up. My postpartum visit. But let me share this with you. A lot can happen within that time. But why is that visit so important? Well, I'm going to share it with you because the postpartum period, those 6 weeks after delivery, is a time of physical healing, mental adjustment, hormone roller coasters, and serious health risks. Now, did you know that more than half of all maternal deaths happen after the baby is born? I just stated that while ago. And the reason why I'm repeating some of this stuff is because I want it to sink in. So what do we get when we miss those appointments? And when mom missed that appointment? I'm going to share that with you too. Well, we want to support the Shift Happen movement. So let me take a moment to do that and just tell you, first of all, to go to shift-tulsa.org. And if you want to help us continue to bring life-changing conversations like this, then most definitely go on there and you can donate at that time. You can do whatever you need to do to support these type of podcast episodes. Now, let's get back to the matter at hand. Why are moms not going back? Well, let me tell you, when they miss their appointments, their checkups, this is what they miss. Screenings for postpartum depression and anxiety, checking for high blood pressure. They could even be missing the signs of and signals of preeclampsia, managing cesarean healing, infections or blood clots, help with breastfeeding, sleep, and birth control decisions. But most importantly, we miss the chance, that powerful question of, Mama, how are you doing? Not the baby, but you. That visit is not just a medical checklist. It's your chance to check on her spirits, on her body, and on her mental health. That's so important. Now, why aren't they going back? And why are people missing their prenatal appointments? I'm going to talk just a little bit about what's standing in the way. Because blaming women for not showing up, nah, we're not going to do that. That's not what we do here. We're going to just kind of shift through and unfold and let's, what they say, peel back some of those layers of the truth that is. Lack of transportation. That's one reason why they're not going back. No child care for other kids. Let's be honest. If you don't have child care put in place, or resources, or help for that matter of fact, for a baby or for the other kids while you're tending to what needs to happen and the reason why you need to go back for your 6 weeks checkup, you're not going to go back. And so we need to make sure those resources are available. Fear of medical bills. Oh my God. I got a story about that one. You know, when I found out I was pregnant, and you hear me talk about it in other episodes of these podcasts that I do, it's not a secret that I was not married and I just got laid off from my job. I was in a situation where, I didn't have much, let's say, even though I had gone to college, not much education on the healthcare, and how it operated. And so I thought, I don't want to keep going to these visits and I don't have insurance put in place or anything because it's just racking up medical bills. When they talked about, you have to regularly attend these prenatal cares, I thought, I don't have insurance. But as I went on to learn more and more about it, and I'm so glad that I pushed myself to go to these visits. There was a lady there and she was like, do you have insurance? And I was like, no, I just been laid off from my job and that insurance with it too. And she was like, great, we will apply for Title 19. I was like, I didn't know much about Title 19, but I was glad for it because it also paid for bills that were accumulated before 3 months prior to that. And so I was just happy to know that. But like I said, had I not have gone back, and that was just during my prenatal time, had I not of gone to those visits, I wouldn't have learned about Title 19. So, those type of things encouraged me to even just show up to my postpartum visits because I was like, what else am I missing? Now, also, mom may not show up because of judgment or dismissal from providers. In this healthcare business, we always have stories, but I have to share this with you. I had a pregnant teen, and it was already hard for us to get her into care. I don't even like to reflect back on the story because it just makes me mad every time I think about it. But she was pregnant and she went in for a visit, and the provider was waiting for her to put her shoes on, and I guess she wasn't putting them on fast enough. So, he told her, can you pick your shoes up and put them on in the lobby? And of course, that just set the tone. I mean, she just did not want to go back. She felt like because she was young and she was a teen rather, that he was judging her, that she was already embarrassed about the fact that she was pregnant and young. And so she just he talked to me that way because of the fact that I was young. So in this business, things have changed. Let me say that we have done some research and education and we're at the same table and we're talking about these type of things that make people not want to get into care. And one of the things that came out of that is how providers talk to their patients. Just because you're a doctor does not give you the right to talk to a patient any kind of way. And so that came out of it. And so I tell that story because I want to say that it doesn't matter who you are, you have a right to be treated fairly. Also, mental health struggles that make leaving the house feel impossible. And with postpartum depression, it is a mental health issue. It's related to it. And I know that it may be hard to face that fact, but women go through postpartum depression. And that can come as quick as after you have the baby. So that sometimes make going to a postpartum visit almost impossible. But if your support system is aware of a lot of things, then they see that right off and they push you to go to those appointments so that you can be screened for postpartum depression and talk to somebody about it and get the necessary help that you need. And let's be honest, some moms think, well, I'm not bleeding anymore. The baby's fine, so I must be okay. But that's not always true. Now, shifting the story, which is what I like to do, is so that we can talk about things that you can do to support mom and why it's so important for her to go back to these appointments. Here's what Shift is doing and what you can do. You can educate moms during pregnancy about the importance of the postpartum visit before the baby is even born. Help moms schedule the visit before they leave the hospital. And that's what you see a lot of times when the nurse or the social worker comes in and they're sitting with mom right before they release the mom and baby to go home. And the first thing they talk about is the 6-week checkup, which is your postpartum checkup. And they're scheduling that appointment for you to come back. So it's important that you keep those appointments. Offer support groups like we do through the Shift Healthy Start because peer support can make all the difference. Push for home visit and virtual options because access matters. I am just so excited about, well, let me say this. Out of the bad comes good. When COVID came around, it brought about a lot of creativity. It brought about a lot of different options for us, things that weren't available before COVID. And virtual is one of the things that came out of it. And so I say that now you can get a postpartum visit through virtual options, something that wasn't available. Train providers to ask the right questions and create a judgment free space. That's so important. I just talked about that story about the team. This isn't about just checking boxes. Nope. It's about saving lives. Now bring her back. And I'm talking to support systems. I'm talking to healthcare systems. I'm talking to anybody that knows someone that's pregnant, that knows that that mother didn't go back for her visit. Push her and bring her back. So if you're listening and you're a provider, remind her. And if you're a partner or a friend, which is such an important piece of that support system, offer to go with her. And if you're a mama yourself, go back to your postpartum. I'm sitting here begging you because I know how important it is. That visit may be quiet. It may feel routine, but it's so important. It might be just a visit that saves your life. Might be the most important visit of all because a healthy baby needs a healthy mama, body, mind, and soul. So, Mighty Shifters, as always, thank you for tuning in to Shift Happens, where we serve up real talk, real impact, slice by slice. Remember, Shift isn't just our name, it's our mission. We're shifting the narrative, the numbers, and the outcome. As I always like to say, I am your bougie, confident boss lady signing off with love, power, and purpose. And to every mama listening, we see you, we need you, and we want you to come back. So until next time, keep shifting. Mighty shifters, keep loving and taking care of yourself. And most important of all, take care of each other. Until the next time we talk, bye for now.